There's a number on your labs that lands in the average column and gets you absolutely nothing. No flag, no follow up, no phone call. It's called hs-CRP, so high sensitivity C reactive protein. It is the closest thing we have to a smoke detector for inflammation in the body. And here's how it gets read. Under 1 is low, between 1 and 3 is average, and over 3 is high. Functionally, for a woman, I want to see it under 1. So a 2.4 sits right in the middle of average. It's not high. Nothing gets flagged. Nobody calls you. And she's walking around achy, puffy, foggy, worn out, holding a piece of paper that says nothing is wrong. So here's the part I really want to be honest about, because most people online won't say it. hs-CRP does not tell you where the inflammation is coming from. It's a smoke detector, not a map. It tells you something is burning somewhere. It just doesn't tell you which room. That is not a weakness of the test. That is the job of the test, and it is exactly why it matters, because if it is sitting at 2.4 and nobody looked further, you never got to ask the next question. 2 things to know before you go get it run. 1, a single reading is not a pattern. A recent cold, an injury, a vaccine, dental work, any of that can push it up. Anything over 10 usually means something acute is going on right now, and it should be rechecked a few weeks later after you're feeling well. 2, look at it next to something else. I like to see it alongside platelets, and if it's available, an ESR. When 2 or 3 numbers are quietly telling the same story, that's a picture. One at a time, it's a shrug. Nobody flags an average. That's how we end up with a normal report and a body that disagrees. So if you want to start reading your own labs instead of waiting for someone else to, I made a free tool for exactly that. Check the caption.